am here. My name is Marva Wisdom, and I am really pleased to be the external lead for the City of Guelph's community plan, where we are working to set the standard for the elimination of systemic racism in our communities. So I'm very excited to be a part of that. And I am even more excited to be speaking today with Dr. Liraz Fridman. She is the transportation safety specialist for the City of Guelph, working in, of course, engineering and transportation services. And I'm going to ask her to share a little bit about herself and how she came to be working in this area at the City of Guelph. So,
Well,
Lee Raz, tell me a little bit about you.
thanks, Marva, for that introduction. So just to give you a brief background about me, I previously, prior to coming to the city, I was working for the Hospital for Sick Children as a postdoctoral fellow there. And really, my research background is in child and youth injury prevention on our roads as it relates to road safety. So, what a lot of people don't really realize is that road collisions are the #1 cause of death for children and actually adults under the age of 44 in Canada, making it a huge public health concern. And what I really wanted to do, sort of with my career moving forward, was to put all that great research into practice and be able to actually apply it. And so when the opportunity came up to work with the fabulous municipality of the City of Guelph, I really jumped on that opportunity to be able to have a hand at looking at policies related to road safety and how we could build them really to affect the entire community as a whole.
Thank you for that. Now you can see that we have someone who has come to us with such great skills and great background, and certainly great passion. And the city of Guelph is very fortunate to have you. So welcome. I'm going to get into one of our next question, which I know that a lot of people will want to know, and certainly we want to know: how are you using an equity lens to help you make better policy and program decisions?
Absolutely. So maybe I'll just start with a brief background and sort of defining some terms. Currently in the city of Guelph, we haven't adopted this larger policy sort of lens called Vision Zero, but we are working towards that as one of the recommendations that's coming through our transportation master plan this year. But really, one of the major pillars of Vision Zero, which is a philosophy that looks to getting injuries from road traffic collisions down to zero, especially ones that cause serious injuries that can cause disability and things of that nature, and of course, fatalities. And so, through that lens, one of the major pillars is this concept of equity. Now, the hard part is, like any group that studies sort of this construct, is looking at what does equity mean in a road safety sort of context, and how can we build that in to our policies moving forward. So, we were fortunate enough at the city to work with Guelph Lab, which is a collaboration between the city and the University of Guelph, to look at different equity seeking groups via sort of their geography and see whether or not they were able to, sorry, this is also falling off my head, to see whether or not they were able to access certain resources and services. So just to give you a bit of a more broad context background of that study, what we looked
Mhm.
at were really three things. We looked at, firstly, the Ontario Marginalization Index. So that uses 18 different indicators to tell us where there are equity seeking groups throughout the city of Guelph. And then on top of that, we were able to map some data on where our service requests come from for road safety initiatives. So an example of that would be traffic calming. When someone's concerned about speeds on their road, for instance, they can request something like a speed cushion or a speed hump, and that comes to our department as a request, and then we go through the policy and the process to get that information out and to collect the data that we need to do in order to actually put an intervention out on the road. So what we did is we mapped the Ontario Marginalization Index, where those service requests were coming from, and then actually where collisions were happening in the city. So every time a collision occurs, the Guelph Police Services sends us a report on that, and we were able to very loosely map out, where are these collisions happening with pedestrians and cyclists, as they're our most vulnerable road users. And what we actually found out was that in a lot of areas that are considered marginalized by this index, there weren't necessarily a lot of service requests coming from this area, but there were a lot of collisions, showing us that
Mhm.
we're not necessarily doing the best job at allocating our resources where the problems lie. But I think the great thing is that now that it's sort of eyes wide open and we know where these locations exist throughout the city, we can build that equity into our road safety policies, our traffic calming policies, and we can be a bit more proactive in how we approach road safety. So rather than waiting for particular members of the community that may not know how to reach out or may not feel comfortable reaching out, we can do that work on our end to ensure that we're being more proactive in going out and putting these resources in place before a fatality or a serious injury occurs.
Wow, that is great. That is really, really good news. I was sharing before I heard of this, but in terms of how the equity lens is being applied, I wasn't sure about it. So this is really good news. So do you see other opportunities to apply this equity lens in the work of local government?
Absolutely. And I think in a broader context, so not necessarily just for the Engineering and Transportation Services Department, I think it all starts with community engagement and ensuring that we're
Mhm.
really engaging and hearing everyone's voice. And I understand that sometimes there's time and resource and capacity issues that come along with that when we're trying to, get things done quickly. But I think it's a really important step that we sort of pause and not only review the policies we already have in place, but again, moving
Mhm.
forward, when we think of all of the great work that we do with our community and going out and asking these really important questions, we need to be seeking out people who may not be seeking us out.
Right.
And so, one example of that, again, as it sort of pertains to the road safety work that we do, is last year we brought the community road safety strategy to the city. So, it was sort of the first of its kind. It got unanimously approved by council, which was fantastic. But part of what we did is, we sort of did our community engagement drop in events in typical areas where we had done them in the past, where we would see a lot of foot traffic and be able to engage with a lot of members. But then we also
Mhm.
got into contact with the local immigration partnership to do more targeted community engagement, again with groups that we might not be able to hear from otherwise. And part of that involved, again, translating things so that people understood it in their language and in their culture and in their context. But I
Mhm.
think from a broader scope, we really need to be better at sort of looking at where can equity be proactively built in, so that, looking forward, we're really applying this lens to all of the policy and planning work that we do at the city.
Great. That's wonderful. And the other question I have for you, do you know of some other good examples of applying an equity lens, whether in the city of Guelph or in other municipalities? You mentioned your work at Sick Kids and road safety and the importance of that. One would have never thought to connect the two. Well, at least I don't. So in talking to you, this is new learning for my brain.
Absolutely. So I think the good and the bad is that, at least in the context of road safety, this concept of building equity is relatively new. But it is gaining traction, and people are starting to listen and learn and apply what they know. And we're still figuring out what the best way to approach a lot of these concerns are. But one
Mhm.
example I can think of, in chatting with other municipalities, I can't think of a specific one, but just sort of other groups that are also looking at the road safety and equity lens, is really that people are starting to build what they consider an equity index. So it's also really getting down to operationalize, what does equity mean? Because it means so many different things to so many different people. And so the example that I initially shared with you, that research was really looking at equity from a geography standpoint, right? It's where do you
Mhm.
live? How easy is it for you to access the sidewalk if you're trying to walk to get your groceries, or whatever that might look like? So it was really just one tiny piece of a very large puzzle. But of course, there are so many other aspects that we can look at. We can look at race, we can look at gender, we can look at ability or disability and how people move around our city and whether that's being equitably distributed. So I think there's a lot of work to be done. I think other municipalities are doing a good job, again, just where I think we're just scratching the surface as it stands right now. But I think we're at the point where people are really starting to talk about this. It's becoming a very large pillar of our Vision Zero programming. And
Mhm.
so I see this, in the next 5 to 10 years, really exploding into something that is makes our policy stronger and ultimately makes our streets safer.
Absolutely. And so I love that you talked about equity can mean different things to different people
Mhm.
within the context of their lived experience, right?
Absolutely.
As well as you mentioned geography, and or what their priorities are. Uh, Equity might mean something different to them. But I think in the work that we're all doing, in the work that you're doing, we're looking at equity to provide opportunities where all can survive and all can thrive, not just survive, but thrive, and that each person feel like they have equity of opportunity to either go where they need to go safely, as you're talking about in transportation, or access our healthcare justice system, and certainly access our government system. I love that you talked about someone who might want to do something differently in their neighborhood when it comes to safety, but they don't know how to access. They don't know how to contact that organization or contact the city to advocate for themselves because they don't have the kinds of power or perceive that they don't have the power that others feel that they perceive. So it's really balancing that power equity at its core. And thank you for that work. This is really awesome. Do you have anything else that you'd like to add to share?
No, I mean, you covered it brilliantly. I was gonna say the other aspect that I can think of in terms of that is just language barriers sometimes too, right?
Hmm.
Is people might not feel comfortable contacting the city because they feel like they don't know how to ask for something appropriately, or they don't understand what we often use sort of this policy language, and it's not necessarily translatable even to people whose first language is English, for example.
Hmm.
So again, I mean, I love that you sort of said not only to survive but to thrive. That is a brilliant way to look at it. And all I can hope for is that we continue to push forward, and people continue to really, in their day to day work, continue to think about equity, and it continues to be top of mind to make sure that again we're building it in, and that it's proactive in nature, and that we don't have to go back to fix our mistakes in the future.
Thank you. That's brilliant. That's a great way to end our conversation. Thank you so much.
Thank you very
Thank
much.
you. This
Great.
was really good.